Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Hyperthyroidism in pregnancy. If there is hyperthyroidism in pregnancy, we should evaluate it properly and we should treat it. The most common cause of hyperthyroidism in pregnancy, the most common cause of hyperthyroidism in pregnancy is mainly by the Graves' disease. Graves' disease is the most common cause of hyperthyroidism in pregnancy. If we see the other causes of hyperthyroidism in pregnancy include, there are other causes should also be considered while thinking of hyperthyroidism. These are autonomously functioning thyroid nodules may be seen. Gestational trophoblastic disease can cause hyperthyroidism in pregnancy. Thyroiditis and even hyperemesis gravidarum can cause hyperthyroidism in pregnancy. Why does gestational trophoblastic disease cause hyperthyroidism in pregnancy? Actually, in gestational trophoblastic disease, there is increased production of human chorionic gonadotropin. This human chorionic gonadotropin will it will mimic the alpha subunit of human chorionic gonadotropin will mimic the alpha subunit of TSH, that is thyroid stimulating hormone. Thus, because of increased human chorionic gonadotropin, the body thinks that TSH is increased and thus it increases the production of thyroid hormones, and thus it is also responsible for hyperthyroidism in pregnancy. So hyperthyroidism in pregnancy, especially if you see a patient to be hyperthyroid in pregnancy in the first trimester, then it is always difficult to control hyperthyroidism in pregnancy in the first trimester. Then in which trimester is it easier to control? It is difficult to control in first trimester, fine. Then when is it easier to control? It is easier to control in third trimester of pregnancy. Then, right, which drug do you use in pregnancy? In pregnancy, actually, methimazole. There are two things. We have two groups of drugs. Methimazole, carbimazole is one part. Second is propyl thiouracil. But they have their adverse effects. Each of them has a problem. So if you see first, if we see the methimazole, for methimazole, especially in methimazole, this methimazole has two disadvantages. One, methimazole can cross the placenta. See, because methimazole can cross the placenta more at a greater degree or at a higher degree when compared to propyl thiouracil, so it is associated with fetal adverse effects. Especially it can cause a teratogenic effect like fetal aplasia cutis is common with methimazole. Whereas if you see the second drug, we have propyl thiouracil. This propyl thiouracil also has one adverse effect. Propyl thiouracil can cause hepatotoxicity in the pregnant female. But yet, because the methimazole is more dangerous to the fetus, so mostly the treatment of choice, if you were asked what is the treatment of choice in hyperthyroidism in pregnancy, it is propyl thiouracil. But okay, so the treatment of choice for hyperthyroidism in pregnancy is definitely propyl thiouracil. But if you were asked what is the treatment of choice in the first trimester, see, in the first trimester, actually, here you cannot give methimazole because methimazole can cause fetal aplasia cutis. Embryogenesis occurs from 3 weeks. Actually, embryogenesis occurs from 3 to 8 weeks period. So as a result, especially in the first trimester, it is not advisable to give a drug which causes teratogenic effect. So as a result, in the first trimester of pregnancy, the treatment of choice is, it is better to give propyl thiouracil in the first trimester. But if you were asked what is the treatment of choice in second and third trimester, okay, actually methimazole crosses placenta and it causes aplasia cutis mainly in the first trimester. After first trimester, that is after 12 weeks, already embryogenesis is complete because embryogenesis occurs from 3rd to 8 weeks. So embryogenesis is already complete after 12 weeks. So methimazole is safer in pregnancy after 12 weeks. But propyl thiouracil, it can cause hepatotoxicity in the pregnant woman. It is present in first trimester, second trimester, and third trimester. So in second and third trimester, methimazole is safer than propyl thiouracil. So as a result, in second and third trimester, we give the patient methimazole. But if you were asked overall treatment of choice, it is propyl thiouracil.
Thank you and thank you for watching.